If you've been in nursing long enough or you're just starting out, it's okay. You might come upon, if you want to do travel nurse, or sometime the facility wants you to do a checklist about your skills. And it's very important, nurse, that you be honest. And I'll tell you what it is all about and what you should check off and what you should not. Stay tuned. Nurse skills checklist. You might hear nurse self tools, clinical self skill checklist about your skills. That's what we're going to discuss right now. And what you might get, they might do it in the computer. They might give you a piece of paper and you just check off. And it's really about your skill. Your skill. So if you never did anything in nursing, you work in the nursing home, you gotta have some skills. If you never work in the hospital. I don't think the nursing home let us fill out a checklist. They may start now. The ones that are acute, long-term care, they may have skill checklists. But mainly it's the travel agency, the nursing agency, and the hospital may ask you to do a checklist of your skill. It's about your clinical skills. And what it is I'll go over some of it for you. And it's from 0, 1, 2, and 3. 0, you're checking off that you've never done it before. 1 is you know you have the knowledge about it, but you never did it. You never, attempt to do it. 2 means maybe you have like a little year knowledge. And 3 mean you are experienced. You know what you're doing. You can do it. You don't need anyone to orient you. And I'm just gonna read off a little bit. It's like this. It's a checklist, and I wrote on it of your skills. So they'll give you, or if you're in psych nursing, they have a checklist for psych nursing. And this is for general nursing. So if you're going on the med surg, they'll have a med surg checklist, ICU checklist, mother baby checklist. So it will start off something like this in general nursing. Admit, orient, involuntary clients. This seems like it's a psych one. If you never did that, initial assessment, comprehensive assessment. If you've never did an assessment on any patient, then you would put a 0. You would just check it off. Some people say check, see those circles? Some people want you to, fill in the circle. Vital signs monitoring. You never did a vital signs before, you put 0. If your experience of doing vital signs, know how to do vital signs, then you're number 3. Check that off. Check, check, check. CPR. You can do CPR. You can do codes. If you're not experienced, don't check that off. You know how to give medication and so forth. I'm not going to go over all of it. It's like a self-evaluation of yourself, what you can do and what you can't do. And the reason why they give you a checklist about your skills, to see where you're at. For the nurse coming into the facility, by doing those skills and you checked off, don't just check and give it in and think nothing of it. Because what it is, the skills that you checked off, it may come back to haunt you. Say, for instance, I'll give you an example. I'm a psych nurse. They accidentally gave me one of the questions on the checklist is, I take care of newborn baby. No, I've never worked with a newborn baby in med surg or in psych, so I would check 0. What if I did check, I work with a newborn, and they put me on the pediatric floor or the newborn floor and I couldn't function? I liable to make a mistake, and that's lying, that's cheating, because, oh, if I checked off that I work with the babies, I'm going to get more money. Don't think of it that way. It's very important when you're starting a job and they give you a checklist is to determine where or how long your orientation is. It has something to do with orientation too. And also to see what level you are as a nurse, that you need more training in certain field. So that checklist is used as an assessment to your own personal skill based on what you say. Some nurse has been around for so long, they know everything, right? I don't know where they are, but there's certain things. I've never been on the ICU floor. I'm not a critical care nurse. I've never worked in the ER doing drips and stuff, so I'm not going to check off any of that. I don't know cardiac. I may have touch base a little with it. I can fill it out a little. Yeah, I have knowledge of it, but as far as experience on the floor by myself working in critical care, I'm lost. So I'm not going to fill that out. And the reason why it helps your hospital employer determine if you are ready skill-wise. It gives you a score. That's what they do. Give you a score. And it determines whether you are experienced in those certain fields based on the score level. And that's calculated, I think, through the computer. And how successful you are. So it's very important. It verifies your critical skill, your knowledge. Honesty is very important. And there's another type of test. The employer going to hire you, and how much you will need if they take that risk. So that skill checklist is very important. It's not a true or false. It's not a multiple choice. It's a self-check. You rate yourself. You simple saying, yes, Patrice, I know that I am 100% anything in psych, I can do it. I have the experience. I can be on my own. I can be a charge nurse. You don't have to monitor me. You're still going to get orientation, everything, but they know how to train you, what determine how long your orientation will be. It's an online assessment with a score of what you feel your skills are. And that's just your honest opinion. Nobody's telling you what to do. You're just going to say, I know to do this. I'm very comfortable in this situation. I have never did ECT. I'm not going to check that I'm comfortable doing ECT because I've never did it. I may have assessed with vital signs. I may observe the patient coming back from ECT. So I have a knowledge of it, but actually doing it, actually working in ECT, I can say, no, I will need some orientation. It's a tool, nurse self tool, that travel agency your local agency is going to be using. It's all over. They like to say, don't you fill out the checklist before you get a job. Don't want you to fill out these checklists, and they will use that. There are some hospitals that will use the checklist about your skills. They will use that. And it's the same setup like I tell you. 1, 2, 3. 3 means your experience. 0 means you have no experience. Evaluate your skills by what you select. So selection is very important. If you're a new nurse, and say you're a new nurse, okay, let's talk about that. And you worked in a nursing home. You have some skills that you can check off. Yes, you were a charge nurse in the nursing home. That you can check off. You know about charge. You may not feel comfortable in the hospital setting, but you have an idea what charge nurse is. So don't put 0. Maybe you might put 2. You need more orientation. You gave medication in the nursing home. I'm pretty sure you're experienced in giving medication, so you should feel comfortable. You did an AccuCheck, several AccuCheck if you work in a nursing home, checking the blood sugar. You are experiencing that. If you feel comfortable, check experience. If not, I need more orientation so that you could get it. And this is the one for the psych. It's asking you, are you experienced with schizophrenic patient, paranoid psychotic disorder? You know about delusional disorder. You know about phobias. You know about depression. Check, check, check. I have that experience. I just wanted to let you know. I would like to think that, and the reason why I'm saying this is it's very important that the honesty is, it helps you, and it's your personal evaluation. They're not going to discriminate against you. They're not going to chastise you. They just want to know you're comfortable at what level. So if you have no knowledge, then you put no knowledge. But I'm pretty sure you have some knowledge working in, if you came in from the nursing home and you're going into the agency or you're going into the hospital, they ask you to do checklists, you have some basic knowledge that you can. You ever did wound care? The wound care in the nursing home is basically the same as in the hospital. Basically, the scores from your checklist about your skills is fulfill JACO requirements. You can look up what JACO requirement is, JCAHO. It determines your clinical knowledge when you get the score, because the way they set it up, it determines your clinical knowledge, your experience, how capable you are to perform the job. If you work in any agency, the first thing they want you to do is a checklist. And that's because the hospital require travel nurse or local agency to fill out a checklist. And that's what the hiring manager at the hospital checks. Now, I don't think they do it for permanent employees at the hospital. So there's several things you can do with that self-checklist. It's really a great tool that you can use if you want to look at the different, like if you work in psych, look at the different skills level, build your skills, what you need for ICU, what you need for mother baby, and work on that each skill that you have over the years. So some people use it as that type of tool. So it's a standard for the hospital to ask the travel agency for this. It's really determined how experience the nurse coming into the hospital, what she's capable, what she can do and what she can't do. And based on the score, the level, then she's placed in that unit that she said. If the travel agency feel that, like, I may not put anything orthopedics, my score is low, then I'm not going to be going into that department. So it's a help. It seems like it's just something that you check off. But to be honest, I like it a lot because I can honestly say by checking off that I don't do, because I'll tell you why. I work for this agency, and I went to California, and they were trying to put me in, what was they trying to put me in? Like pediatric ICU. And I was trying to tell them, no, I'm a psych nurse, but you work with kids, and they fighting with them is impossible. And I'm trying to tell them, no, I'm not going there because I don't feel safe. I don't know anything about critical care for babies, real sick babies. And I had to go to the hospital for the orientation. I told the hospital, I'm not safe. And then they went back and forth with the agency, and it got me off that floor immediately. So sometimes you got to be careful. You may fill it out, or they may not ask you, and they may try to push you somewhere where you don't have the skill. That's why it's important that when you do your skill checklist, you keep a copy and be honest about what you can and what you can't do, because they use that religiously. As you grow, your nursing skill checklist grows too. And you have to self-evaluate yearly. So the agency may ask you if you're still with the agency, update your checklist, Patrice. You just keep it up to date. And it's also a good self-assessment because, in nursing, you may try out different fields. So I may not have experience in different field, and somehow along the way, I got some experience. So next time I fill out my checklist, yes, I've been in hospice. I've been a hospice nurse, and I can now work in hospice. But I'm not going to say, if I just did one shift in hospice, I'm not going to say I have experience as a hospice nurse. Yes, I did, but I still need orientation. I still need some more experience. So I'm just going to fill out maybe I know the knowledge. I've worked there before, but I still don't have that kind of experience. Checklist about your skill. Your checklist is very important. It's also a tool, a nursing tool and requirement for employment. So fill that out with care and be honest, because honesty is the best policy. You don't want to be thrown into something that you are not familiar with and you need. And as you grow along in nursing, you will expand your skill, and before you know it, you're a full-blown experienced nurse. You won't touch every skills, but you will have enough under your belt to keep you safe. So fill out those checklists if you get it, and be honest with yourself. As a matter of fact, you could go online and just pull up nurses' checklist and see what kind of skills after you graduate. Wait until after you graduate and you got a job now, and keep a record of your experience, what you have done, what you think you're comfortable doing, like medication, doing a treatment, a sterile treatment, doing blood sugar. If you're comfortable in that setting, then you are one step ahead of the game. And you will get it. So be patient with yourself. Do you think, are you up to it? And I want to end by saying, I really appreciate you. And I thank you for your support. And any question, I need to hear more question that you need from me. And I'm going to try to do more.